Hi, this is Mayor Bob Fox. I'd like to talk about the COVID vaccine. First, let me say that our country has never faced a challenge like this in my history, or the history I can remember, in disseminating these vaccines. It's an unusual situation. They're doing this vaccine in phases. They're doing healthcare workers. Those first line people really need that to be able to treat people that have COVID. Long-term care residents, the most vulnerable, their staffs, first responders, other healthcare workers, and then as it phases through the process, it goes on to other essential workers and those with medical issues and elderly, and then underserved populations, because they are also very vulnerable. And so what they're doing and the process they're doing it, I think, will serve us well. It's a good strategy. I think it's fair to the local public, and I think it's good that our local public health authority is kind of in charge of our area, because that gives us some local control so we can identify those people who need it the most. Remember, it's a two-stage vaccination. The Pfizer vaccine, which has been approved, you'll get another vaccine in 21 days. The Moderna vaccine, which should be approved today or tomorrow, is also a two-stage vaccine, and it's 28 days. The vaccines will be available, and they'll give you a schedule when you have your vaccine so that you'll go back for your second dose. There are, with any vaccine, any medication you take, there are some side effects. They're very rare. 3 to 5% of the population will exhibit some minor disruption, just like you do with the flu vaccine. Maybe your arm might get sore. You're not getting the virus. Many flu vaccines, you're actually getting a dose of the virus. This one you're not, so you're not going to get COVID from this vaccine. Anything you take over the counter, any prescription medication you take, you've got a chance of side effects that probably are the same or more than what this is. You cannot be required to be vaccinated. Your employer cannot demand you be vaccinated, but I would suggest you do so. Do it for your safety. Do it for the safety of your loved ones and people you work with and your family. We want to return to normalcy as soon as we can. And with most of us getting this vaccine, that will happen a lot sooner. So join me, and please get this vaccine if it's available. Thank you.